You're in the emergency room, possibly fighting for your life, and the first thing they ask for is your insurance card. Hi, Dr. Brian here, retired physician, now functional medicine health coach and founder of Health Without Risk. Yesterday on another platform, an internal medicine doctor asked one simple but devastating question. When did you realize healthcare is broken? The response was a flood of personal, frustrating, and often absurd stories. They confirm everything I discovered during my 30 years inside that conventional machine and why I focus now on getting people healthy outside of that system. I want to share the 5 most powerful answers that resonated with me. The first realization for many involves the financial absurdity of the system. It often feels like you're treated as a source of revenue before you're treated as a human being. Listen to this answer. Number 1. Several years ago, when I was laying there in the emergency room in my boxer briefs, after emergency transport by ambulance and 4 IV bags connected to me, when an admin rolls in with a laptop on a cart and asks me for my insurance card, unquote. It's clear where the priorities lie, and the lack of cost transparency is infuriating. Answer 2, I bet for some people it will be when I asked how much something would cost, and nobody in the doctor's office could tell me. There's a reason this isn't a new fight. This next response is short but powerful. Answer number 3, 1848 AMA. The American Medical Association was formed on May 7, 1847, and represents a long history of institutional control over medicine. The next set of stories showcases the failure of the system to look at the whole person and to provide adequate time for genuine care. This is a crucial point for men and women dealing with hormonal and age-related changes. Listen to the shocking lack of understanding here. Answer 4. When what I really needed was testosterone, but they tried to put me on birth control pills, I'd had my tubes tied 25 years prior, antidepressants and anxiety meds, went somewhere else, paid out of pocket, and I truly did need testosterone. My blood level had been a 4, unquote. A functional medicine practitioner would have looked at that woman's low testosterone, understood the symptoms of aging and fatigue, and addressed the root cause. Instead, the default solution was symptom masking, birth control, antidepressants, and anxiety meds. And this one speaks to the pressure physicians are under. Answer number 5. When my GP complained that I was taking up too much of his time and said he couldn't read the previous GP's notes, all while I was explaining that the private consultant I'd hired needed blood work that the GP practice had messed up for the 3rd time, unquote. That private consultant could have been me, but I fixed that by giving my clients access to Rupa Health to order their own labs, the link's in the bio link. But in the conventional modern healthcare arena, your 10-minute appointment is driven by corporate productivity metrics. You cannot get the focused attention needed to manage complex or chronic health issues. As a retired physician, now health coach, my perspective is that the system has fostered dependency on the system. But the most hopeful voices are the ones who've taken back control. The system is broken, but you don't have to be. We have to heed this last piece of advice, answer 6. When I have to educate the doc who doesn't bother reading any medical information. My body is the only one I will get. I am more invested in its longevity than anyone else, so don't get mad when I do my own research, unquote. That is the Health Without Risk philosophy in a nutshell. You must become the CEO of your own health. You must question, you must research, and you must find practitioners who will be your partner, not just a prescription writer. So tell me, what was the moment you realized healthcare was broken? Let me know in the comments. Hit the like and share if you've had a similar realization. And remember to subscribe to or follow Health Without Risk, where we explore options for better health you won't hear from mainstream medicine. Thanks for watching. Bye.